I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Good morning, this is Dr. Jonathan Lebowitz, the Long Island Gynecomastia Center, Long Island VaserLipo Center. We're early December still, and we're doing a touch-up gynecomastia. Now, this guy looks amazing. Make some muscles. Do your thing. I mean, he looks great. Make a muscle, kind of do your right. And in the scheme of gynecomastia surgery, he looks great. Yeah, he can lose a little weight still. He lost actually 20 pounds since the initial one in May. Now, let's look at the initial photos right now. And now this is today, and he wants a touch-up, and I don't argue with anybody. Somebody wants a little bit. It takes me an hour and a half. He doesn't want to, I usually want to do a touch-up. Even now, I go down here. He doesn't want a second incision by the nipple, only in the armpit, which I originally do. So through my probes and stuff, I'll go down probably to this little spot here. This is an accessory nipple, and go and really kind of etch him better. Nothing over here. I want to maintain volume here. He's got this great Delto-Pectoral Groove. Show me the groove there. Make a muscle there. See that? And I'm gonna actually make that a little bit bigger, a little deeper in there. But I'm gonna really kind of scoop him out a little bit more and give him that better hockey stick shape right there, only through my stealth incision right over there. So this is the way he looks now. This is the pre-op once again that I did in May right now. And this is what he looks, and he looks amazing. And most plastic surgeons would say, you look great, don't do anything. But if he's like me, obsessive compulsive about the way his body is, that's great, and I'll even make him better. I will not hurt him. I'll not do anything that he'll regret, and we'll just kind of fine-tune this to perfection. Takes an hour out of my time, big deal. Takes an hour out of his time, big deal. He'll be back to work tomorrow. So let's mark him and go to the OR. So again, these are my markings, because he doesn't want a second incision here, so I'm going to give an incision right there, deep in the delto-pectoral grooves. He just wants this kind of like hockey stick part here. He doesn't want me to go down the belly, because to do that I got to make an incision here to go down, and he doesn't really want that, and he's in great shape. So take me an hour. We're going to vaser, and we're going to do our thing, and he doesn't even have to come back so fast because there's no stitches, there's nothing to really do, and we'll just talk over the phone, and I'll see him in a couple of weeks post-op. So off to the OR we go in a minute. So again, this is a touch-up. This groove is actually very nice, but I'll hit it a little bit nicer here. See that groove? Come over here. See this groove right there? Shows the edge of the pec. But again, he's not 21. How old are you?
41.
41. So he's got a little loose skin, but I'm going to hit him hard again and, and give him, what humanly possible to give. And if he wants a third touch-up, I'll give another touch-up. I'll give another touch-up. I don't think he's going to want that.
No,
but
one and done. That's it. Two and done, actually.
Two and done. All right, so we got this. Let me put this through, undo that. So, good. All right, so lift up over here. So let's do this over here. Gonna pump you up.
To pump you up.
Delto-pectoral groove. Just because, let's just do it again. This is the protective port. Mm-hmm. So here we go. This is a touch-up. So a little scar tissue. He just looks amazing. You saw on the pre-op. But, if somebody comes to me and, a guy like this, he's in his 40s, looks great, they get greedy and they want a little bit better, or more, not better, more. So I'm just going to hit him with this. This is amazing for touch-ups, because the hardest part is getting the fluid in. So he doesn't want me to go as far down because he's in good shape and he wants to work out on his own, and he doesn't want the second incision again, because to get that far I got to give a second incision. So what I'm doing now is really kind of just hitting this again. There's no gland to really get rid of now. So it's really just kind of melting more of the fat. Give him a little extra touch up to get even better results. Get over here. Get that hockey stick again. There you go. Get over here. Right here. Let's go a little deeper here because he wants to be flatter, but I don't want any bulk missing over here. Up on the top, the upper lats, the upper pecs. It's a combination of technology, technique, skill, passion. So now we're liposuctioning it. I'm not using the My Power X because it's really a fine tuning, and I want to fine tune this with the regular one so I can really feel where things are. So I'm really getting this hockey stick and really thinning it down. All the way here. Not going above this line because I want to maintain volume here. Not going and just transition it under the nipple because he's very self-conscious about his nipples. He dreams about his nipples. Just going to do a little bit of a curveness here to it. Because it's a redo and he's got a little scar tissue there, I'm just going to put some Cannulog 10, some steroids right inside that nipple. And he's numb, so it's not good. Right in there. Done on one side. So once again, Dr. Jonathan Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center. So this guy looked great. I did him early part of the year. He called me up. He wanted a little touch up, and I said no problem. But I mean, he really looked great. The pre-op from May of this year, right now, and then the pre-op of this right now. And now you can see what we've done. We really sculpted them out nice, newer techniques I'm always thinking and doing. And every once in a while, people need a touch up and, something, whatever. Come in, do it. My pleasure. We'll have fun. Give him a little steroid shot to beat up some of the scar tissue here. He did not want a new incision by his nipple, which I don't blame him. But now make a muscle here. Make a muscle. There you go. So that's great. I put a little steroid in there, so that's a little blown up there, but he's gonna be looking amazing and very happy with the results. So Dr. Lebowitz, Long Island Gynecomastia Center, Long Island VaserLipo Center. Why be great when you can be exceptional? And this is exceptional work. 631-424-0101, 631-424-0101. Thank you and see you soon.